Thank you for your interest in this clinical research study. This study may be a good fit for you if you are 40 years or older and have received a diagnosis of idiopathic pulmonary fibrosis or IPF. IPF is a disease that harms the lungs. It causes scar tissue to build up. This leads to shortness of breath and a cough that doesn't go away. Over time, this makes it harder for people with IPF to accomplish everyday activities. Right now, there are only 2 medicines for IPF that can slow down the progression of lung scarring. However, they don't work the same for everyone. Most people still get worse even while taking them. That's why it's important to keep looking for new treatments and find better ways to slow down the disease. We are conducting this study to see if an experimental study drug called MTX-463 can slow or stop IPF from worsening and improve the lives of people with IPF. This study will recruit around 164 people with IPF. Half will receive the study drug MTX-463, half will receive a placebo which contains no active drug. Many studies like this one use a placebo to help make sure that any changes seen are due to the study drug and not some other factor. No one will choose which treatment they receive. It will be decided randomly through a computer. And neither you nor your study team will know which one you're receiving until the end of the study. However, the study doctor will be able to find out this information, if needed, for safety reasons. If you are interested in joining this study, you will be asked to sign an Informed Consent Form, or ICF. The ICF will explain the study in even more detail. You will then enter the screening period, which may last up to 4 weeks. During your screening visit at the study site, we'll ask you some health-related questions and do a few tests to make sure this study is a good fit for you and that it's safe for you to take part. You may need to have a special imaging test called a high-resolution CT scan, or HRCT, which takes detailed pictures of your lungs. If you've had this scan within 90 days of the screening visit or already had a lung biopsy to diagnose IPF, you might not need to have the scan again. If we confirm that you're a good fit for the study, you will enter the treatment period, which will last 24 weeks. The study team will give you your treatment at the study site through an intravenous infusion, which means into a vein. You will receive 1 infusion every 4 weeks for a total of 6 infusions. After your last infusion, you'll come back for an end-of-treatment visit 4 weeks later, and then a safety follow-up visit another 4 weeks after that. Overall, your participation in the study will last about 32 weeks, or around 8 months including screening. Over the course of the study, we will closely monitor your health. Scheduled visits may include physical exams, vital sign checks, blood tests, lung function tests, and talking to the staff. To help the study doctor assess your condition, you will also be asked to complete questionnaires about your symptoms and how your condition is affecting your quality of life. Participation in this study does not guarantee that your condition will improve. And you should carefully read the ICF before agreeing to take part. Your participation is completely voluntary, and you can leave the study at any time. If you decide not to take part, your normal care will continue. If you have any questions, please speak to the study doctor or study staff. Thank you for considering taking part in this study.